Hi, so this is Josamay Miranda from BSN Level 3, Block 1. So for today's video, I'm going to discuss and teach you how to perform oxygen therapy, or also known as O2 therapy. O2 stands for oxygen gas. So first things first, what is an oxygen therapy? Oxygen therapy is a treatment that delivers oxygen gas for you to breathe. You can receive oxygen treatment from a tube resting in your nose, a simple face mask, or a tube placed in your trachea or windpipe. This treatment increases the amount of oxygen to your lungs, received and delivered to your blood. Next is understanding your blood oxygen saturation level, or your SpO2. So first, what is your blood oxygen saturation, or SpO2? Oxygen saturation is the fraction of oxygen saturated hemoglobin relative to the total amount of hemoglobin to your blood. Now, for the normal values, average of the population has 95 to 100% SpO2, meaning the red blood cells are well oxygenated and sufficiently transporting oxygen around the body. Next one is below average for the population, which has 91 to 94% SpO2, meaning your patient needs to monitor closely. And the last one is less than or equal to 90%, which consider consulting your doctor, which is not normal. And did you also know that COPD patient, or patient that has chronic obstructive pulmonary disease, has only 88 to 92% SpO2? Now, for the nursing assessment, first you have to assess the client's level of consciousness, level of understanding and knowledge. Second, you have to assess the client's vital sign. Third one is you have to assess the client's breath sounds, any signs and symptoms of respiratory distress. And last one, you also need to assess the availability and functionality of the needed materials. You will be needing this one, and also this one, this, and the last one. Now let's move on to the procedure. First, you have to check and verify the doctor's order. Second is you have to identify your patients using two patient identifier, which is the patient's full name and his or her birth date. Third is to put the hypo tray on the bedside table. Don't forget to perform hand washing and put on PPE if indicated. Set the bed to a comfortable height and lower the side rails where you will work. Next is to position the client in a semi-Fowler's position. Next is to attach the nasal cannula to the oxygen with a humidifier. Turn on oxygen flow rate until bubbling is noted. Next is to regulate flow rate as prescribed liters per minute. An oxygen cannula or mask to the client. For the nasal cannula, first you have to clean the patient's nostril using moist cotton balls. Second is to place the cannula prong upward to client's nose. Then last one is to slip attached tubing around the ear and under the chin. Now for the face mask, place mask over nose, mouth, and chin. Adjust the strap at nose bridge. And then place the elastic band around the head. And then you have to stay with the client for a time to observe response for treatment. Remove cannula each shift or every 4 hours to assess the skin and to avoid medical pressure injury. Don't forget to remove the mask every 2 to 4 hours. Wipe away accumulated mist and assess the underlying skin. Don't forget to discard used equipment properly. And then last, document the procedure and patient's response and other important data on the client's chart. And that's how you perform oxygen therapy. Thank you!